I'm going to talk about precision nutrition and the tools I think we need and some dreams that I think we pretty much all have today. I have these objectives to talk about how we can use AI in optimizing our work and delivering our work to patients and in our research and reducing documentation burden. So what if a standard blood test could identify the dietary pattern of your patient? Brand new patient, you've never ever seen them before, but you have this blood test in front of you, just like the comprehensive metabolic panel or whatever it is you normally would see when you first see the patient. What if it also could tell you, oh, this person normally consumes a Mediterranean diet, or this person consumes a Western diet, or that would be so informative just to start out the conversation. And we're very close to being able to do that today. The people from Johns Hopkins have looked into the ERIC study and found that there are some metabolomics that identify dietary acid load and the pattern, food pattern that goes along with it. They also looked at metabolomics of the dietary intake of children with chronic kidney disease from the CKD children's study, and found similar metabolic profiles that could identify it without you having to go through what dietitians have to go through to find out what your patient's likes and dislikes are or what their normal food patterns are. This blood test panel was available at the time of meeting with the dietitian would be the what if. I kind of gave that away. Here's another one. The dietitian's note could be structured with data fields in standardized language. Several years ago, the Academy of Nutrition and Dietetics decided this was a necessary thing for dietitians to have access to being able to categorize what they're saying. And it's been, I would say, kind of slow to catch on because it's a little cumbersome and it's similar to, but not, the diagnosis codes that physicians use. It's strictly about nutrition, and so if it's only the dietitian's using it, it makes it a little difficult for everybody else to see that that's a data point. But we're getting there. I think it will happen and be better for everyone if we can actually standardize the language that we use. It would increase efficiency, personalization, summarization, and contribute to precision care planning. And so that was the goal of the Academy of Nutrition maybe 15 years ago. I don't know, Annabelle, do you recall when that came out? But it's still slow to catch on. And in chronic kidney disease, I'm seeing a little bit, and our transplant dietitians are using a little bit of the PES statement. For me, because my heart is in nutrition, but also in research, it really would improve our ability to understand what we could address from a quality care standpoint or from a research standpoint. So what if the patient care plan meeting could look like this one? What if my nutrition assessment of the patient showed up maybe where that global map is right now? And it's just, here's my assessment, and it shows up in this small visual screen, and you're sitting around with your social worker and your nurse and your nephrologist, and you're deciding, what do we want for the future for this patient? And your patient's in the room. What if it could look like that? And I think it can. I don't know if Fresenius, maybe people from Fresenius have already figured this out because you've got thousands of centers and multi-thousands of patients. You probably are having care plan meetings like this, but it didn't look like this when I was doing it. So we decided in our transplant program at Houston Methodist, because we have a large program, and that means we have a lot of data, that we wanted to do something to understand some precision. What would our approach be? We decided to look into automating unstructured notes, which everybody has them. Because this is my team, my data science team that are doing this. I got to choose which entity we started with. So I said, let's start with the dietitian notes, because I understand them. And I know where they come from, and I know how they're built. So it actually was probably a good decision, because we could have started with the social worker notes, but that would have been really hard for me. So I needed to guide my team, and so we started with the dietitian note. I'll show you what we did. We wanted to know, can we efficiently extract meaningful insight from highly unstructured notes to support our transplant patient care and future planning for these patients? They're all clinical notes. even though we say we put, assessment in a certain category and we put planning in another category and we put things in categories, they're still highly unstructured. Manual review of them is very time consuming, and clinical notes are difficult to analyze from a quality standpoint or for a research project. They're very difficult to analyze, no matter what entity you're looking at. So we started with a group of people that are probably the easiest patient population to study, and that is living donor candidates. They're healthy. They don't have problems, generally. So we wanted to know, okay, what did these notes tell us? We saw over 1,300 dietitian notes with kidney donor candidates in our data set. They had at least one visit with a transplant dietitian. And 171 had more than one visit. And I thought that was curious. Why? So we focused on candidates, had 2 visits to see what we could learn from these 2 visits. So the first thing we did was word cloud. Everybody in this room probably knows, surely knows what a word cloud is. It's developed, strictly out of the words that are used in the notes. And you can see they're all over the place. This is actually after quite a bit of cleaning. What normally showed up on the first round was medical history, donor, the things that didn't help me, didn't mean anything to me. So we selected the words to pull away from the report and came with these. And then we looked at the ones who had multiple visits, and we could see, right off the bat, it was because of weight, it was a diet, it was because, something that they needed to change, so they needed a second visit. But this is not data for me. So my data analyst used a text summarization workflow that he drew out here, where he took the raw notes, moved them to an NLP summarizer, and then the output was a summary of the text. And he did this using Python. And he parsed the data using plain text parser, and then moved it into a tokenizer, and then the sentences were then split for graphic construction, and he used a LexRank summarizer to build a sentence similarity grid, and that ranks the sentences by centrality and selects the top ones for the summary. And then the output was a short summary of the information that was provided in that note, that if you printed out, the note would be 2 and sometimes 3 pages long for a person who is healthy. So the efficiency increased from 3 to 4 minutes of looking just manually at the report to fewer than 10 seconds. He might say 20, but for me it was like, oh, I can see it, I get it, I see what they did. It was very helpful. So the word cloud changed with the summary. So the first visit on the left is what, for these 152 or whatever the number was, who saw the dietitian more than once, the first visit was on the left, and then the follow-up visit is on the right, and you can see the difference. Again, it's not data. So we drew on Microsoft Copilot to turn this into some data. And Copilot, as you've probably used, is an AI chat tool built for work environments. It protects the data, so information from your chat conversation is not exposed to the public. We had enterprise data protection that we utilize at our hospital, and we're required to do that for doing anything like this. But even still, we have to make sure that we pose the question to Copilot, and this is sort of the question that he asked. Patients saw the dietitian on visit 1 and visit 2. What was the difference between the visits? And produce a column with the result. So this is what we got. We learned that 68% of the patients had seen the dietitian for a follow-up visit due to weight or BMI management. 15% were for general follow-up, and 7% were for diet reinforcement. The rest falls into 3 or 4 more categories, none of which were dominant. But the takeaway from this is that what did we learn from taking this approach? Unstructured notes are extremely hard to aggregate for analysis, and but we can use NLP and large language models to help us. It significantly improves the time efficiency compared to the manual reviews. And LLM, in our case, which was Microsoft Copilot, can be used widely to analyze these notes. But we have to consider precautions, and those of you in the room understand this. We have, in healthcare, have to control the LLM. We can't, it has no advanced privacy protections on it already. So we have to be very sure and careful that we're not introducing any PHI or PII into the model that we load into it, even if we are using an environmentally safe version of Microsoft Copilot. So enterprise versions, as I said, can be used, but you still have to take care to not enter any of that into the Copilot. So what if, again, progress notes could be summarized in real time? What if I wrote my progress note and spent my first visit with the patient as an hour, 45 minutes? What if at the end of my note, I see the summary myself? What if that summarization could be compiled into an overall team summary for patient status and planning, so that the social worker can see what my summary was, so that the nephrologist can see what my summary was? They don't have to go through that whole thing, that a lot of which is just loaded in from Epic, from something else in Epic, that I would love to get my hands on designing what that ought to be for the dietitian note. But it is what it is right now. And what if that could be compiled so that everybody is looking at a chart like this, visuals that help you see your patient is right there in the middle of that dark green spot on the left. What does Bob Smith mean? Why is he there? And is that a good place for him to be? Is it a bad place for him to be? What can I do to improve it? So here's one idea, and some of you may be familiar with this. You may have seen it before, but the National Cancer Center has developed a dietary intake tool that's used in What We Eat in America, which is the study that is done every year across America. It contributes to the National Health and Nutrition Examination Survey. It's the method that they use to capture dietary intake of Americans. This is the output from it. This is mine, actually, and I happen to be dieting right now, so although I was kind of pleased with parts of it, there were some parts I could have done better. But I wanted you to see just the visuals that come from it. So when you put your information in, this is what you get back. The person who puts their information in, this is what they get back. What if this could be on my dietitian note when I sit down with the patient, because they filled it out before they saw me in the clinic? When I'm seeing a patient, I spend a good 25 minutes talking with them about what their likes and dislikes are, what foods they normally eat. This would be right in my face, and I could see where I could help them. What's needed to make this happen is for that tool that belongs to the National Cancer Institute at NIH to be able to talk to Epic and load straight into my patient's note. And that's a dream that I think could happen in a year or two, if somebody can make it happen. Not me, but somebody can. So I leave you with some of my favorite inspirational people. It's not what you look at that matters, it's what you see. Henry David Thoreau. Another, Joel A. Barker said, "Vision without action is merely a dream. Action without vision just passes the time. Vision with action can change the world." And I think this is what AI is going to be able to do for us if people, like the people in this room, influence what it does and can do. And then last, my favorite person to quote for many, many reasons is, if you're working on something exciting that you really care about, you don't have to be pushed. The vision just pulls you in, right? Thanks.